that you touched on, and we notice that a lot here at Steinberg as we see your guys' referrals come through, is not all of your patients are what you would consider kids for the name Cure for the Kids. So tell us a little bit more about those patients and kind of help the audience understand at what age are you too old to be a Cure for the Kids patient?
In a sense, as our mission really is to fill the gaps in healthcare, there's some, rare diseases that occur in children, including childhood cancer, that their health effects extend well into adulthood, and sometimes it's just difficult to find a good transition of care to an adult care provider here in the community, and we kind of just take up the reins and continue following those children and young adults. There are definitely pediatric cancers that then overlap into the young adult realm, and so we sometimes will co-manage those with our adult colleagues, and they ask for our help because we know the protocols and the treatments kind of better than they do even. And then with regards to the bleeding disorders, because those are disorders that started well into childhood, sometimes we're just so familiar with the management of those diseases that it's the pediatric hematologists who are best able to manage those, and that includes sickle cell as well, at least into young adulthood.
All right, Dr. Nunes, tell us all about genetics.
I tend to see trios, and so I say, the child, the mother, and the father, and we identify genetic issues for the family. And so the two big issues are, can we identify something that needs medical management based on that genetic diagnosis? And so once you have the diagnosis, there may be some implications for healthcare for that child. The second is reproductive management for the family, and so families want to know, what's the chance that I'll have another child with autism? What's the chance that I'll have another child with cleft lip and palate? What's the chance that I'll have another child with osteogenesis imperfecta? And so that's a very important aspect of what we do. Perhaps the third one, I call diagnostic odyssey, which is the families are looking for an answer. They've been dealing with this condition. They don't know whether it's genetic or not. They've been seeking an answer for a long time. And as I discussed, we have completed this decade where our ability to find that genetic answer, is so much greater than it was before.
How else have you both seen technology impact the way you treat patients?
There's a very wide-ranging answer I can give to that, because obviously there's technology with regards to new medications and new treatments, genetic therapies and immunotherapies, but then you get into more, mechanical, advances. Just having the ability to do a virtual visit with either patients or do virtual consultations with other experts around the country. You can see their faces, they can share their screens with you, that kind of collaboration has just increased since the advent of the internet and good, speed Ethernet connections. And then with regards to imaging, for example, your specialty here at SDMI, the machines are just doing amazing things. The MRIs are 1,000 times better than they used to be. PET CTs and other functional nuclear medicine imaging has just advanced greatly in the last 20 years. That's allowing us to really better treat both our children and young adults with cancer.
A radiologist can provide so many clues for our genetic diagnoses. So the hidden ones, the ones that we can't see, so ultrasound identifying malformations in the kidney, a chest x-ray identifying 11 ribs instead of 12 is a major clue, for us with regard to kind of patterns of diagnosis in kids with developmental delay. Identification of skeletal dysplasias. A really good pediatric radiologist can bring our game up and really help us figure out the exact right genetic test to do for a family. So I think that all technologies rise, but I think that I'm biased. I think that the genetic technology really, our ability to kind of find these answers, even all cancers genetic at the level of the cells, and are able to identify the pathways that they can use pharmacologic agents to kind of attack that cancer. Those are kind of genetics is kind of at the forefront of those advances.
And I think this is just a really great reminder to the audience that there are some very highly specialized physicians in Las Vegas, and we're very lucky in this area to have access to these kinds of, to physicians like yourselves and those that you collaborate with. What would you tell patients that are watching this that think, hey, I think there may be something with my kiddo that is not quite right? How did they get to you?
Talk to your pediatrician. And so the pediatrician's collecting a tremendous amount of information about your child. They're plotting a growth curve, which is a vital sign in pediatrics. It tells us a lot of information. They're collecting information about development, the skills that your child is acquiring. So talk to your pediatrician first. And if your pediatrician is identifying something that could benefit from a specialty evaluation, the pediatrician will make that referral.